Hey, I'm Brittany Arender, and today I'm going to be doing my NG tube insertion video. The first thing I'm going to do is check my physician's order, and then I'm going to identify my patient by checking their armband against the procedure card. So I've done that. I'm going to wash my hands and then put on clean gloves. I've already assisted my patient into a high Fowler's position. And then the next thing I'm going to do is drape his chest with a towel. I also have an emesis basin, a cup of water or ice chips available for the patient to swallow. Next thing I'm going to do is check my patient's nose for patency to see which nostril is the best to use. Blow for me. Okay, and the patient's right nostril is what I'm going to use. I am going to then measure. So I'm going to go from the tip of my patient's nose to the tip of their ear down to the xiphoid process, and then I'm going to mark that with some tape. All right, and then once I've done that, I'm going to then lubricate my NG tube with 3 to 4 inches of water soluble lubricant. Okay. Before I insert this, I'm going to ask the patient to put their chin to their neck and swallow while I slowly insert the tube. Okay. Put your chin to your neck and then swallow for me. I'm also going to note any complications if the patient has them. I'm going to secure this really quickly. Okay. If the patient had any type of distress like gasping, coughing, cyanosis, trouble breathing, I would stop the procedure. So now that I have the tube temporarily in place, I am going to determine the placement of the tube just to make sure it's in the right place. So if I do, I'm going to aspirate some gastric contents. So I have this. I'm just going to pull just a little bit, and then I'm going to take this and check it on my pH strip. Okay. And we're also going to get a chest x-ray to verify the placement. So once placement is verified, we're going to secure the NG tube with tape. Okay, and then I'm going to attach it to feeding or suction, whatever the physician ordered. I am going to take my gloves off, perform hand hygiene. I'm going to record the procedure. I'm going to record the size and type of tube that I use, the type of, or which nair that I used, the description of gastric contents, and the patient's response. I'm also going to state, for the purposes of this video, why a patient may need an NG tube. So it can be used for an array of things, such as for an abdominal obstruction or an ileus. A patient may not be able to tolerate anything by mouth and may need suctioning. They may need to receive nutrition via their NG tube. So there's all sorts of reasons that the patient may need it. So I think that's it.